Hello and welcome to Community Pulse, a public affairs show about public health and wellness in Chicago. My name is Levi Moore and I'm one of the two rotating co-hosts for Community Pulse. And today, my guests are Dr. Neelum Aggarwal and Stephen Fadowole. Thank you so much for appearing on Community Pulse today.
Thank you.
Thank you.
First, before we start, I've got some housekeeping I have to do. Okay. Community Pulse is sponsored by the Hectone Institute of Medicine. It's a not-for-profit that's been around Chicago for like 80 years working in the public health sector. Hectone also sponsors the Foxglove Alliance, and where I serve as a coordinator. Foxglove is a coalition of 15 public health organizations in the city of Chicago. And we look at Community Pulse as an outreach and education tool to help people learn more about what's going on in public health and wellness in Chicago. So to start off, to get to know you two, beyond work. So Dr. A, and that was, I knew I wasn't going to call you Dr. Aggarwal. I'm going to call her Neelum. I'm just out of habit. And I didn't want to start because I've met you I've known you in so many different roles. I want to say it was with the Jesse Brown VA, the foundation at the start. So, Dr. A, tell us about yourself.
Well, that's right. I mean, we've had our paths crossed so many times, but it's always been around health, community, and issues that we're facing here in Chicago. So I am a physician. I am a neurologist. I practice at the Rush Alzheimer's Disease Center at Rush University Medical Center. I do a lot of different things. I do studies on aging. I do epidemiology studies here in Chicago with our communities, and clinical trials, and then see patients at the Rush Heart Center for Women.
Okay. I always try to disclose that, I work with Stephen. I'm on the Walgreens Patient Advisory Board, and that's how we met, like almost to the day 1 year ago. So, Stephen, tell us about yourself.
Absolutely. Stephen Fadowole, pharmacist by background. I've been with Walgreens pushing 10 years. I filled different roles in the field. I've been a specialty pharmacist. I've worked as a pharmacy manager. And I've also worked as a community advocate as well too. I've worked on different campaigns, especially around COVID. We helped drive the awareness, the importance and awareness of COVID-19 vaccines with faith-based organizations as well. So very, very heavy in the community space.
Okay. Well, let me frame this a little bit for you. Okay. For the last, all this year, a lot of the shows that I host have really focused around clinical trials from various aspects. And it goes along with one of Foxglove's key initiatives, the M3R campaign, which is designed to get more minorities to participate in clinical trials, but just everybody in clinical trials because it's needed. So today we have two good examples. Okay. Dr. A and her work with Rush, she kind of represents the traditional model. And then what Walgreens is doing is almost sort of like a disruptor, like the way where when Uber came in and kind of completely changed cab or rideshare. So, Doctor, tell us, can you tell us about, Rush's footprint in clinical trials and just, and then we're going to go into a very key point, how do you get into a clinical trial?
It's so timely too. It's kind of like an anniversary for me. So when I came to Rush, I was already, as part of my training, coming in as a fellow, I was able to get involved in clinical trials. But up to that point, Levi, when I did my training in neurology at Henry Ford in Detroit, we weren't really involved in trials. Stroke trials, when you had an acute stroke, Yes, that's when TPA, you remember that, Stephen,
Yes.
TPA was coming in, the drug that's given in the emergency room
Yeah.
to some people. But there was no real focus in my medical training about trials. So that when I came to Rush in 1996, that's when I started to hear about trials. So the traditional model was you are involved with other academic centers, and the trials that they may want to put through as a consortia would mean that you sign on and say, I want to be a part of this trial. And that's what we've done at Rush since that time, where we have basically run trials through consortia that are not necessarily here in Chicago.
Okay.
It could be based out in California, which this one was. And people that were coming through the clinic, and again, the traditional model, coming through your clinic that you thought would qualify based on certain criteria, then they would be presented a trial for whatever. It could be a behavior trial, it could be a medicine trial, but they were presented trials. And that has been this model, even to this day, where it's people coming through the hospital, the clinic, or referred to a specialist like me to say, Dr. A, so-and-so has, let's say, dementia, evaluate for treatment, and any trials that you may be doing. And that's how the model has been. It's been a very heavy hospital clinic model to come into a trial. Yeah.
Well, the clinical trial I was in was probably about 20 years ago, and that's kind of like how it was. I had a condition, physician, my doctor said, this is beyond me, so I'm going to look for a clinical trial for you. And he found one, and it wasn't at his hospital, it was at the University of Chicago Hospital. And what the key was, they were looking for people that had these two specific autoimmune conditions, and I had both. Lucky me. But no, that was how.
But I'm thankful for your physician who was thinking ahead about trials. The majority of the docs, and just think back to me, coming out of residency training. Right? I'm already a physician and I'm getting extra training now. No discussion about how to do a trial, how to run a trial, the paperwork needed for a trial, how to talk to patients about trials. So your doc was forward thinking like, okay, this may not be working. Let's think about a trial, and he was in the know to where to refer. And I think this is one thing I really want to see changing now, because especially in my area, when we're talking about brain health, preserving brain health, preventing memory loss, not just treating Alzheimer's disease, dementia, but preventing, there are so many trials, Levi, that people could even think about, how do I participate, yet it's not discussed in that typical clinic visit.
Very true.
It's not.
I kind of heard of clinical trials and really didn't know much about them until I needed to be in one.
Right.
You are an anomaly, right? Like your scenario is not everyone else's scenario. In fact, there's studies that show that about 90% of people haven't heard about clinical trials. But when you sample those people, you see about 50 to 60% of those people that will be open. So which means that there are people that don't know that clinical trial is out there, but when approached, would most likely end up enrolling in a clinical trial. That could benefit them as well.
Right, and that the problem with that is if they don't know, then the narrative, and we all know this, is that, well, that population of folks aren't going to want to come in. Don't even ask that. And we got to stop this narrative going on. You don't ask. I've said this for years. You need to ask. And then respectfully, if there's a yes or a no or tell me more, then you take it from there. But that's the thing we're dealing with now, right, Levi? The lack of representation.
Transition. Stephen.
Yes.
People, when I tell people that I'm on this Walgreens patient, it's like, what do you mean clinical trials in Walgreens? Like what? So can you explain to us, how does it work?
Yeah, every time I hear that conversation about what clinical trials, Walgreens clinical trials, it reminds me of the amount of work that my team has to has to do to ensure that everybody out there is aware that Walgreens is in clinical trials. So think about how you have Walgreens stores across the U.S., right? And how impactful those stores can be in driving accessibility to people that we just talked about who don't know that there's clinical trials out there, but would be open. And that's what the model that we're going based off is. We have stores that are assets that we can deploy clinical trial CRCs, clinical research coordinators in those areas, and they could cater to patients, right? They could meet patients at their needs, right?
Yeah.
We talk about understanding that a participant in a clinical trial is not just a number. There's things going on. There's social determinants of health. There are things that are happening in their life, and we want to holistically appeal to that and be able to solve for that as well.
I remember I was on this kind of a rapid communications rapid response team during COVID, and you're kind of part. And then they realized that, people may not see their doctor regularly, but if they're on medication, they see their pharmacist all the time.
Tell me about it.
And it was sort of like, ding, the light bulb went off and figured out that this is an ideal way to do it. Let's get to something that a lot of people ask, and we've talked about. A lot of people don't even know how to start to find a clinical trial. So with both of your, what would that entail? How would they do it?
Yeah. That's a really good question. I think obviously shows like this where we're talking about it, where people are just, I came across this show, I'm learning about it. I think there's a learning curve first to understand the different types of trials. And it's really important. We have trials that are having medications, right? And then we have what we call trials or studies where we just follow people every year. We do some memory tests, in our case, for brain health and aging. We do memory tests. We do tests on functional activity. We're not actually giving a drug. We may be saying, this may be a diet you should adhere to.
Well, yeah, because I remember you were doing the one, I think it was for people who had suffered strokes, and you could speed their recovery through an adjustment in diet.
And that trial is ongoing right now, and that's a great example. This trial is called Nourish. We're doing it here in Chicago. It's with Rush University of Chicago and Advocate. We finished recruitment, but that trial was enrolling people from the hospital when they had a stroke, when they went home. They then, if they qualified, they then were put in a study where they would be getting a diet to see if we can slow down any changes in memory after stroke, which is very common. Now that trial basically is in the field, Levi. We are in the field for that trial. There was one visit that came to the office, and after that, the home visits were there, the meals got delivered at home. We would pick people up to the scanner to get a brain scan, but we were that community model, right? But I would say if you're interested in trials, there's two things you can do ahead of time before you enter the physician, I'm going to say the hospital system.
Yes.
The first thing is, if you're interested in aging, that's my area, you want to go on the right now you can go onto the NIH website or ask a family member to go on there and look at, just type in clinical trials. There will be a list of some trials that are ongoing, and at least start to get familiar with what they're doing.
Yes.
Okay, and you're going to then know, that one doesn't appeal to me, that one is something that I'd like. Okay. The second thing you can do is, if you're interested, like for me, my people are very interested in preventing Alzheimer's, they'll go to Rush and they'll go on the Rush website and type in Rush Alzheimer's Disease Center, okay? And that will then give a website page that will say if you're interested in trials. But I'm really advocating, Levi, you have to educate a little bit yourself before you enter the health system about what's out there.
Yeah, because the interesting thing too is that you have trials not for necessarily when someone has a condition.
Right.
Yeah.
Right.
But
Healthy volunteers.
Exactly.
Yeah, one of the things that we've stressed on this show is know your family medical history.
Right.
And in terms of there are studies that are preventive.
Yes,
Yeah.
exactly. Exactly. And I think that you're seeing probably with your team, right, Stephen? They have to do a lot of educating about trials. And I'm always saying, we haven't done a good job with this. We haven't been taking this conversation out in the communities to say, when you're in a trial, it's like a protocol. It's like you have to do certain things at certain times. This is what a trial means, so that people understand what it's all about.
And to your point, Dr. Neelum, I think that there are things that have to be done on our end that could also help facilitate that. To your point, those conversations have to be had, right? And those needs of those potential participants have to also be considered. And then we also have to realize that there are systemic barriers that have hindered accessibility to studies.
Very, very true.
And that's the approach that we go at it with Walgreens Clinical Trials, which is we're very intentional about how we're having those conversations in the communities, right? And because we know that people come to our pharmacies, right? They pick up their prescriptions, they buy their groceries. We want to use that as a pivot point to start having those conversations. That's why you could go to any of our 20 clinical trial sites across the U.S. and you could have a conversation with a clinical research coordinator over there. Yeah. And then also, you probably might hear about Stephen or other team members who are in churches that you attend. I like to think of it as a surround sound approach, where we're in the stores, to your point, that we're also in your church, we're working with your community-based organizations. You can also see us sometimes at your local events. We're at events that, so you see Walgreens Clinical Trials, Walgreens Clinical Trials.
Right.
So what is clinical trials?
Exactly.
Then it inspires that conversation about, how can I learn more about clinical trials? And then simple.
Yeah,
And
here's what's going I'm sure what's going to answer. I went to my Walgreens. I didn't see anything about clinical trials.
Exactly.
and
So true.
that's a very good point, because we're only in 20 sites across our 8,000 plus stores.
Okay.
So the easiest thing to do is go to Walgreens website and then Walgreens/clinical trials, or very simple, just Google Walgreens and clinical trials, and it'll take you directly to that page. And on that page is very user friendly, because you're going to see a list of all the studies. You're also going to see a list of all the sites and where we're located, because that's also very important as well. We're 20 sites across 8 states. And then we also have other geographies as well that we're also creating awareness for different studies as well that are outside of the 20 sites that we currently operate.
And I would even say, bring your kids on this. When this is happening, start that, when you're talking about family history, right? Okay, this is a great conversation starter.
Yes.
Okay, and now we're coming up in the holiday season. It's even better now. We are coming up into Thanksgiving and Christmas. This is a great time to just see what, frankly, the temperature of the family is about these kinds of trials and what the concerns are. Because if you say, let's go on the website, the adult kids and the grandkids are going to be looking and saying, oh, Grandma, that's interesting. Well, tell me more about it. There is already that kind of, you're building community around yourself that was going to help you to understand more about a trial, that if it's offered, you can say, bring in the adult daughter, or bring in who may be involved with that. And that's how it has to be a normal conversation. It really does, right, Stephen? It has to be part of our health, right? Your health when you're in a trial.
And especially now with, it's my number. It's this stat. Because of the baby boomers, every day in the United States, 10,000 people are turning 65 years old.
Yeah.
And it's changing the dynamics of everything. There's this epidemic among my friends of having to take care of their parents.
Yes, yes.
And now being more sensitive to, that runs in the family, or stuff like that. We're doing pretty good on time. So another question I was wondering about is, we had this event this morning that Stephen was part of, and it was Fox Glove Alliance and the Portis Foundation sponsored the Illinois Medical District. And we were starting to see these kind of different models, because one company, Invenio, they were using mobile units. Yeah. Because one of the business, I have transportation issues, or I can't leave home, or whatever. And then they're they've switched to a different model where they're going to be embedded in prime hospitals. But then we had traditionals. Where do you see, where do you see, both of you see, upon your vision glasses, where do you see clinical trials being at in like 5 years from now? Like how they might be done a little bit different?
I would love to see the trials being done in the community, number one, and then that community to me is either at a trusted community center where people go, as you said, congregate, where the mobile teams come in, set up, and do those visits that are structured. The data collected is rigorous. Everything is done, or it's done in the home, where a lot of the things that need to be done can be done in the home setting. And the only thing that would bring somebody to, let's say, the medical center is the machinery, frankly.
Okay.
If you need a brain scan, you have to come into a big center. If you need to get something special done, you need to come into the center. People are okay with that. They are totally understanding. Yeah, you can't do that out here, but everything else, and I've had this over my career, Dr. A, you've been in the house doing all these visits over your career for this study. Why can't they bring the trials here in the homes? And to do that in the home. If you're doing it on other studies, right? So I'm thinking the medicine trials, the trials where we're, the traditional ones that we do should be already designed to be more amenable to be mobile in the homes.
Stephen.
So the way I look at it is the future is dependent on three things, right? The first thing is time.
Yeah.
The second thing is solving for misinformation. And the third thing is solving for accessibility. If those three things are solved, then you can take a crystal ball and project that when you have a study or a path that caters to the time and the convenience of someone participating in clinical trials, number one. Number two is that misinformation. If you're able to provide education, because some of this is just a sit-down conversation breaking down why this is and why this is not, right?
Well, because you've got the problem now of the disinformation is louder than the true information.
Absolutely. And that's why I said it's not that people are not open. They're open, but they have a wrong perception that needs to be corrected.
Exactly.
Give us what some of the wrong perceptions are. Like, what have you heard?
No, I mean, if you look at the history of clinical trials, it has not necessarily been pleasant, right?
No.
If you think about Tuskegee and some of the mishaps in the past, and those are barriers that are built on generation after generation. So now it's for us to start going back and having those conversations about those mistakes of the past, acknowledging it, obviously, right? But ensuring that we're driving and highlighting that there are changes that have been made. For example, IRB, right? For example, informed consent. There are things that have happened that will ensure that something like that will never happen. And imagine someone in that generation, for example, a baby boomer who may have experienced that or had someone who directly was involved in that.
Yeah,
very hard.
They're still there, and they're elders of the family now.
Right.
So now
they're passing it down.
To your point, so now we have to sit down and we have to have those conversations.
Right.
And then there's something else that's very interesting. What about the kids of those people who are my age, the younger generation, who may not even have had any direct connection to anybody who had participated in those mishaps, right? And so it's important for us to not just have a one-size-fits-all approach. How can we, to your point, meet people at their needs?
Right,
and that's where Walgreens clinical trial, in my opinion, will thrive, because now we're in 8,000 stores. We're in 20 sites, right? We have 8,000 stores and we're in 20 sites. But each of those sites have different communities. So now we're adapting the way that we're engaging people. We're doing research.
Just think of what Stephen's saying. When you think about points of contact, I'm really big on points of contact. How many points of contact that you may have, or I have as a physician, that go so not utilized or basically maximized with the patient to talk about trials? you have when they come in for picking up their meds.
Multiple points
You know,
of
there is a
contact.
blood pressure trial that's coming out right now that's looking, you know, you're on these 3 meds, and you know what? That's that could be a trial that your physician could consider for you to come in.
Absolutely.
We're talking about like things that people are dealing with: a
Yeah.
diabetes trial, a
Yeah.
pressure trial, a cholesterol issue trial. I want to, you know, address a little bit about these barriers that have been in the past. They're very well documented, and when I hear them, and I do hear them, yes, I will sit and I'm going to listen.
Absolutely.
And it's not like I've heard it all. No, I'm going to listen because these are real lived events that people have either experienced, as you said, or heard, that are really impacting their ability to make a decision about this. But one thing that has changed, Levi, is that we have now seen this push for disclosure
Yes.
of results.
Absolutely.
During
Absolutely.
We
trials,
talked about that
right?
this morning. Yeah.
Disclosure of results.
What happens to the
Exactly. We, over the years, when we were doing trials, it was under research. And when you would get certain testing done during the course of the study, well, that's research. We can't tell you what that is until the trial is over, the data is clean, the last, you know, this whole thing. Now, because of pressure, and this is good, these results are being disclosed. You did this to me. What does this mean?
Yeah.
And I think that is really helping with the trust issue.
I hate to do this, but we may need to do another show.
Yeah.
But I need to wrap up. Dr. H. Stephen, thank you
Yeah.
so much for appearing on Community Pulse today.
Sure.
And just to give you a sense of how we're going to change, early next month, in December, will be the only time of the year where you see both of the co-hosts on set together. We always do our end of the year wrap up, and I know we're going to film that around December 4th. And the plan is that hopefully in 2026, we will go back to doing 2 new shows a month with a 3rd rotating co-host.
That's exciting.
So with that, thank you.
Thank you.
Thank
Thanks.
you. And be healthy, Chicago. Thank
Thank you so much.
Yeah, thanks everyone.